Hello and welcome everyone to Making Public Health Personal. This podcast is brought to you by the CUNY Graduate School of Public Health and Health Policy in New York City. I'm your host, Laura Meoli-Ferrigon. Thanks for listening. Today for Women's History Month, we're joined by three esteemed guests who will shed light on the pressing issues surrounding maternal, child, reproductive, and sexual health in the United States. Together, we'll delve into the unique curriculum offered at CUNY SPH that addresses these crucial areas. We'll explore the exciting new additions to our Sexual and Reproductive Justice Hub, including the prestigious Byllye Avery Endowed Professorship in Sexual and Reproductive Justice. Learn about the ongoing research aimed at safeguarding reproductive justice rights across the nation. And join us as we uncover ways that you can actively contribute to the preservation of these rights and enact meaningful change. Our first guest is Senior Associate Director of Academic and Student Affairs, Terry McGovern. Prior to joining CUNY SPH, she served as Senior Program Officer in the Gender, Rights, and Equality Unit of the Ford Foundation, where she oversaw global and domestic programming related to HIV, gender, LGBT, and human rights. She founded and was the Executive Director of the HIV Law Project, which led to the expansion of HIV-related disability criteria so that women and low-income individuals can qualify for Medicaid and Social Security benefits, and included women of childbearing potential to be included in early phases of FDA clinical trials. Next, we have Diana Romero, who is a professor in the Department of Community Health and Social Sciences and director of the Maternal, Child, Reproductive, and Sexual Health Specialization here at CUNY SPH. She serves on the Scientific Advisory Board for the New York City Department of Health's Pregnancy Risk Assessment Monitoring System and has also served on the FDA Obstetrics and Gynecological Devices Advisory Panel, as well as on the board of directors of several nonprofit research and advocacy organizations addressing reproduction, gender, and health. Our third guest is Sarah Pickering, doctoral candidate in the Community Health and Health Policy program at CUNY SPH, with a specialization in maternal, child, reproductive, and sexual health. She is the Research Operations Manager at Planned Parenthood in Southeastern Pennsylvania, where she oversees clinical and socio-behavioral research on many sexual and reproductive health issues, including abortion access, sexually transmitted infection testing, and contraception. Sarah, Diana, and Terry, thank you for joining me on the podcast today.
Great to be here.
So let's start with Diana. Tell us about the MPH and PhD specialization in maternal, child, reproductive, and sexual health here at CUNY SPH. And as the director of the program, can you tell our listeners a bit about what this program has to offer and what makes it unique?
Yeah, no, I'm happy to talk about it. I would say that firstly, the fact that it includes maternal, child, reproductive, and sexual health is already a unique aspect of the specialization. There are programs out there that might specialize particularly in reproductive and sexual health, and there's long history of programs at schools of public health that have focused on maternal and child health. And we recognize that all of these areas are so intricately connected to each other that addressing all of them and the intersections among them is, I think, particularly unique. As far as the MPH and PhD specialization in MCRSH, what I think is really beneficial to our students is that they can come to our school and do an MPH or a PhD in a particular disciplinary area. And then at the same time, they can specialize in maternal, child, reproductive, and or sexual health. So they don't have to choose between a public health disciplinary area like community health or epidemiology, for example, and focusing on maternal, child, reproductive, and sexual health. They can actually bring the two together. And so it's integrated into our degree programs.
And Sarah, you completed courses in the specialization. Can you tell us about your experience as a student and how what you've learned has informed your current work?
So I completed 2 courses within the specialization. One was really focused on public health issues and approaches within this topic, and the other was focused on the life course. In both courses, I was able to really deep dive into topics that I'm passionate about. So abortion access, for example. And my current work, I am the research manager of Planned Parenthood Southeastern Pennsylvania, which serves Philadelphia and the surrounding counties. We do a lot of research around abortion access, as well as sexual and reproductive health. And this coursework has informed the way I approach studies, how I design them, how I manage them. It's really given me the history and the knowledge in reproductive rights and reproductive health that enables me to be successful in my current role.
Absolutely. And Terry, so the bigger umbrella that this specialization falls under at CUNY SPH is the Sexual and Reproductive Justice Academic Hub. Can you tell our listeners about that and the very exciting new Byllye Avery Endowed Professorship in Sexual and Reproductive Justice?
I think what Diana described, which is a non-siloed approach to this set of interwoven disciplines, is the Sexual and Reproductive Justice Hub is actually just taking that a step further. A long time ago, Black women in particular, but women of color started to say, we need to look at justice issues and we need to look at intersecting issues. In other words, maternal mortality is higher in Black women because of a lot of structural issues, including environmental exposures that have to do with where industry is and how housing is. So I think there's been an increasing move towards understanding that we have the Dobbs decision, et cetera, not because of science and evidence, but because of a lot of injustice, a lot of structural issues, a lot of issues around everything from voting to investment in maternal child health, to sexuality education or the lack thereof. All of these factors are playing out in women, girls, pregnant people's lives. And this broader framework, which uses the word justice intentionally, I think allows us to not only look at the science and evidence and scholarship, but also make sure we're looking at justice and policy and how to move the needle. So pursuant to all of that, we saw that at least at a School of Public Health, there hasn't been yet a sexual and reproductive justice professor. And so we've been in the process of trying to raise funds to create the first sexual and reproductive justice professor to be part of the specialization, with the kind of mandate of looking at all of these issues. And I think expanding the curriculum maybe, or investigating expanding the curriculum in ways that really reflect what our students say they need out there. Because certainly one thing they need is how to negotiate, how to exist when it's all about politics and not science and evidence. So I think we're going to try to take on some of those issues as well.
Absolutely. And Diana, can you tell us a bit more about the curriculum?
Yes, the MCRSH specialization allows for 15 credits out of the MPH and PhD. And so a good number of electives are available, as well as 2 core required courses that all students must take. But the electives range from a course in social inequality, reproductive and sexual health policy and justice, focus on adolescent health, the health of young people, sexual health promotion. We have courses in child welfare, as well as methods courses that can be used in the specialization for students who are very interested in research methods and applying research methods to topics within MCRSH. So, for example, our GIS course, qualitative research methods, a course in health communication and social marketing. Those, for example, can be used towards a specialization because students get to focus a significant component of those courses on a relevant topic. And then, of course, the students in the MPH will do fieldwork and capstone, and those will be designed specifically to address a topic within MCRSH.
And Sarah, you're a PhD student here yourself at SPH, working on a very important dissertation that recommends actions to protect and expand abortion access across the entire United States. Can you tell us more about this?
So my project was designed to identify priority actions for protecting and expanding abortion access, specifically in states with different policy categorizations. And those categorizations were assigned by the Guttmacher Institute, who does policy assessments. And so the findings are for states with protected access to abortion, states with mixed access, so they have a mix of protections and restrictions, and then states with restricted access to abortion. We had 85 experts on abortion participate in this project. And I'll tell you about some of the recommendations that were agreed upon by over 70% of these participants. For protected states, the top recommendations were to integrate abortion into primary care. There was also a finding about the importance of expanding the types of abortions that can be provided. So telehealth and in person, to really give patients the abortion experience that they are looking for to the extent that's possible. And then in states with mixed access to abortion, the top recommendations were to develop referral chains for patients seeking abortion in states that are, if they can't access abortion in their home state, to expand Medicaid coverage for abortion, which has been an issue for many years. And again, to expand clinical services to cover different types of abortion, and also to build broad coalitions across different places and different movements for abortion access. And then in restricted states, the top recommendations were to combat gerrymandering and voter suppression, to train emergency room clinicians in abortion provision, and to establish protections for people seeking and providing abortions. And I'll just give a couple of bigger picture takeaways from my dissertation. One was this mix, as you see from the restricted states, of the need for rapid response actions like training emergency room staff with these bigger picture systemic issues like gerrymandering and voter suppression. Another was around broad coalition building, which came up again and again, but it was always coupled with this appreciation for the local and local expertise and local leadership. And that connected well with reproductive justice tenets, which was a constant thread in my project. As Terry was saying about, we can't view abortion as in a vacuum. It's part of a larger spectrum. And also with this idea of patients being able to choose and determine the type of abortion experience that they have, which also honors reproductive justice.
Definitely. And you mentioned some really important reasons why this subject matter is more important than ever. Did anyone else want to jump in and tell us why this subject of maternal, child, reproductive, and sexual health is so much more important than ever here in 2024? Terry?
I think we all could. I mean, obviously, there were lots of problems with Roe, access to abortion, Medicaid not being used to pay for abortion. So there's a whole set of long-term problems around all of these issues. Do you even think about the gag rule we attached to our foreign assistance, restrictions that really tore apart health systems around the world? Then the Trump administration did it domestically. So we've been thrown into this kind of defensive position where, in a moment where we really were making strides in reducing all kinds of bad outcomes, and we got thrown into a completely defensive posture where we're actually just trying to keep people alive. And the way that the Supreme Court decided the case with Mississippi, which has one of the worst records on maternal child health, worst foster care records, being the state that overturned the constitutional right to abortion, it has unleashed just endless amounts of harm, not only on pregnant individuals, but on providers, on families, and is not rooted in science or evidence. And as we see countries around the world who had criminalized abortion changing their law because of the increase in particular of maternal mortality among young people, this is what has been unleashed in this country. And you can talk about it in many different ways. And obviously the other part is that we see in these referendums, every single one has been successful, that this is not the will of people. Even conservative states have voted to uphold access to abortion. So it's very important that we continue to talk about this harm that seems to be really about wanting to control people's bodily autonomy. And of course, the injustices play out along the lines that injustice plays out in this country: race, gender, economic opportunity. So it's very important that the school continue to do the excellent work that it's been doing, but also respond to this changing field, right? Because there's so much going on.
Go ahead, Diana.
Essentially, abortion is healthcare, and its existence or access to it or lack of access to it can be linked to numerous things, but just a short list would be maternal mortality. And that is a crisis nationwide, certainly in New York City. The disparities in maternal mortality are incredibly disturbing, to say the least, the racial ethnic disparities. But there's also the reality of imperfect contraception, right? There's the reality, sad as it is, of sexual assault and of miscarriage and non-viable pregnancies. So there is a spectrum, and that's just a select few circumstances under which abortion really needs to continue to be part of the medical care that is provided to everyone who needs it.
Absolutely. And Diana, you're a member of the New York City Department of Health Advisory Board for the CDC Pregnancy Risk Assessment Monitoring System. Can you explain what that is and the importance of having our faculty so involved with this type of work?
Yeah, so PRAMS, or the Pregnancy Risk Assessment Monitoring System, is actually a federal ongoing survey initiative that is run by the CDC, and it is fielded by the large majority of states in the country as well as large cities. So New York City has its own PRAMS separate from the New York State PRAMS. And so I and many others serve on the Scientific Advisory Board for the New York City Department of Health and Mental Hygiene PRAMS unit. And every few years, they will field a PRAMS survey. It's a representative survey of individuals who had given birth in the previous year. And it is a monitoring system to collect data on the experience of pregnancy, the experience around childbirth, as well as the postpartum experience. And it is from this serial survey that is done that the city is able to detect whether there have been improvements in pregnancy-related outcomes or problematic outcomes that really need attention. What's really, I think, impressive is that the health department has recently been, among other things, looking at childbirth justice and has included measures in the PRAMS, recent PRAMS, to try to really assess what individuals' experiences have been with being pregnant and giving birth, and the potential for receiving disrespectful care during childbirth and how that might vary across different members of the population, the experience potentially with discriminatory care, things that are not very easy to measure, but could certainly have an impact on outcomes and is not the way any institution would want to deliver care. So that's just, I think, a very select focus that maybe recently has been included in the PRAMS survey, but they will also look at a wide range of pregnancy and childbirth related outcomes, postpartum depression, and other topics as well.
That's really important. And what impresses me about interviewing people like yourself and just other professors at CUNY is that you guys are so involved with the state, the city, and these organizations that are really on the ground making a difference.
If you dream of making a difference in the world, a public health degree or certificate can give you the tools to do just that. The City University of New York's Graduate School of Public Health and Health Policy equips public health professionals to advance not only a healthier New York City, but a healthier world for us all. We want you to join us in our mission. Visit sph.cuny.edu to learn more about our programs. No matter where you are in your career, CUNY SPH offers a broad range of degree and certificate programs to not only help you advance in your career, but to have a real impact on the world. Public health professionals are needed now more than ever. Join us. Visit sph.cuny.edu to learn more.
Terry, can you speak to CUNY's commitment to sexual and reproductive justice and how we are taking a step further to address human rights violations?
I mean, CUNY School of Public Health has social justice in its mission, which is pretty special, actually. I think CUNY is at its core about justice and injustice. And I think there's been all of this really amazing work around all of these issues at CUNY. Now we're at this moment where we're just naming it what it is. which is really, I think, science, evidence, and justice, right? So I think we are, with the creation of the hub, taking a step forward to say, we cannot talk about these issues without talking about justice, because look what's playing out around the country. And I think that gives me chills to say that, because CUNY is such an amazing public institution. And for CUNY to have been doing this work and now to take a step even further to say, like, we are saying to the world, we are committed to this and we are committed to it through this justice lens, I just think is so exciting and frankly inspiring. So, and of course our students, and I am new to the party relatively, I've been here 6 months, but I have to say the students are so amazing. I think if anybody is going to fix this crazy world, it's going to be our students. So I think we are just trying to keep pace with what they need in this really ever-changing kind of picture around abortion access.
Yeah, and the news lately when it comes to women's rights in the US has been frustrating. We've spoken a bit about that so far. What can our listeners do to make a difference? Go ahead, Sarah.
I would say there's a lot of amazing organizations that are doing the work. For example, All Above All has been doing broad coalition building for abortion access. There's an organization called URGE that marries reproductive rights and justice with voter registration and voter mobilization. And so looking into those types of organizations and supporting them is something that I encourage everyone listening to do. And then, of course, donating and supporting to your local abortion fund, your local abortion provider, your local Planned Parenthood affiliate. All that support is needed and much appreciated and goes a long way.
We'll include those links in the podcast description. Diana?
Yeah, I would add that for folks who aren't aware, abortion funds really go directly to individuals who are in need of abortion and either can't afford the expenses where they are or may actually need support to travel. And in this post-ops environment, traveling for abortion is actually much more necessary than prior. Not that wasn't the case prior, but it certainly has increased quite a bit. So that's where individuals can actually feel like they're making a difference, maybe one person at a time. The other thing I would say is that paying particularly close attention to candidates as we are in an election season, and every year at some point there's an election for someone, but certainly this year it's quite important. And paying very close attention to candidates' positions in certain places. There are referenda that continue to be proposed, if not actually make it to the ballot. This is where I think we can have a real impact on potential policies by ensuring that individuals who might support policies against abortion access do not get voted in.
Yeah. And I would just add that I think our graduates or students end up in organizations or settings often where leaders may not be seeing the connections between abortion and all of the issues that we've talked about, right? Basic justice issues. And I think often students have the information to be able to say, no, we can't just sideline this issue. It's related to all else. And I'm thinking of many students who end up in humanitarian organizations and other organizations who want to take a position of, we don't want to deal with the fallout around abortion. I think students are now prepared to actually, be strategic, talk to others, but pick up some of those battles because they're very important. So I think there's just so much people can do.
Well, that's very inspiring. And I'll start with Diana on this one. What makes public health personal to you?
I would say that two things are really important to me when it comes to my work in public health. One is my particular personal background, having grown up in New York City and Queens, and being the child of Puerto Rican parents who moved from the Bronx to Queens when I was a couple of years old because they wanted a better life for me. And the Bronx was not in the best shape at the time. And so made lots of sacrifices to do what might seem to others as not such a big move, which is from one borough to the next, right? And growing up and experiencing financial difficulties, educational difficulties, things with extended family, just I think a lot of the challenges that many individuals in New York City and maybe other large urban centers face that could very well lead to negative health outcomes. And not that I was aware of it at the time, but certainly over time became aware of it. And so I feel that gives me a real maybe understanding and personal connection to the groups that public health probably matters most for. And then I would say, secondly, the area of reproductive and sexual health to me is incredibly important, and I'm passionate about it. I do see it connected to so many other aspects of individuals' lives and health, and so intertwined with bodily autonomy and gender that it is really probably the main reason why I came into public health.
That's great. And Sarah, what about you?
For me, it was also the main reason I came to public health. I've worked with many patients over the years. I started my career as an assistant with abortion procedures and literally holding people's hands. And every patient I met, they were making the right decision for them. And I think being outraged about the level of intrusion on people's personal decision-making motivates me to keep doing the work and makes it really personal to me. And even walking into my work right now, we have people outside yelling at us for going in, for working at Planned Parenthood. And that makes it personal on a daily basis.
And Terry, what makes public health personal to you?
I was raised Irish Catholic, and the kind of legacy, what really misogynistic patriarchal policies did to my ancestors, and to see what it did even growing up in New York, going to Catholic schools, seeing how many of my peers' lives were literally destroyed because they didn't have access to abortion. And in these very complicated, complex situations that Diana described, sometimes rape, sometimes a lack of understanding of sexuality, education, all these issues play at power imbalance. And I just saw so many lives continue to be destroyed because of a lack of bodily autonomy. And then I will just say that when I became a lawyer, and I was just a poverty lawyer, but all of these women with HIV started coming in 1987. And I saw the fact that the government had not looked at women really and hadn't put women on notice at any level that they were at risk, and that the actual definition that was then picked up and used as the gateway to Medicaid and disability and housing was discriminatory. Seeing these women and how incredible they were, and they literally had to spend their last months fighting to prove that they had AIDS, and many died without Medicaid, without disability. It changed me forever in my understanding of science and evidence and structural racism, frankly, and sexism. So those lessons stay with me in everything I do.
Thanks again, Terry, Diana, and Sarah, for being a guest during Women's History Month. And thank you all for listening to Making Public Health Personal, presented by the CUNY Graduate School of Public Health and Health Policy in New York City. You can now share, like, and subscribe to our show anywhere podcasts are heard and on our YouTube channel. To find out more about our school, you can visit sph.cuny.edu or connect with us on social media. This is your host, Laura Meoli-Ferrigon, signing off. And while public health has a global impact, that doesn't mean we can't make it personal.